Thank you so much, everyone. So this concludes the first session of track 1. And now we encourage all the delegates to join for the poster session and cast their votes.
Good afternoon, everyone. My name is Dr. Nawfal Kindi, and today we'd like to share me and with my colleague about our poster. It's about relapse rate among rehabilitation patients during April 2020 in comparison to the same period in the previous year, 2019 in Abu Dhabi. So it's a retrospective record review. Dr. Medhat Al-Sabahi, Dr. Ala Naqbi, and myself and my colleague, Dr. Amna Al-Mismari from Sheikh Khalifa Hospital in the BSP. We'll start a little bit about the background. By reviewing and studying the general situation, it became clear that the social and health aspect in general and deeply affected with the stability of mental situation and social rehabilitation are the pillar on which the treatment plan for psychiatric rehabilitation is established. Non-compliance is a highly common in patients with mental illness. 50% of patients on oral antipsychotic showed non-compliance, comparing to 25% to the PET injection. A strong evidence of the superiority of long-acting injectable antipsychotic over oral antipsychotic in relapse prevention and reduction in mortality rate in schizophrenia. The finding of this study may help in drawing forward-looking solution in the event of this health crisis. So we'll talk about our method. So we had about 100 patients, and the data collection was targeting the population and rehabilitation patients. We include the CCMT, day center, and the day center clinic as well. The age was mainly between 18 to 65 years old and admitted to the psychiatric rehabilitation during the period of April 2020 and April 2019. The data analysis was the basic demographic data were collected to understanding we had the criteria for the data, the age, and as we mentioned, we include the age between 18 to 65 years old, the genders, both female and male, psychiatric diagnosis, and some patients were on oral antipsychotic, others were on long-acting dopamine injection, and if the patient receiving psychology treatment and their occupational treatment, and number of visits to the hospital, any need for care plan revised, and the main efficacy outcome if the patients are stable, or relapse with no admission or relapse requiring admission. So the inclusion criteria was patient admitted to the psychiatric rehabilitation unit during the specific period time we mentioned, and the exclusion criteria was pediatric patient under 18 years old, geriatric patient above 65 years of age, and patient with learning disability, current substance misuse, and current forensic cases. Those are all excluded criteria. The data obtained from the patient record collected in Excel sheet, and now we will move on to the result.
So after collecting the information, we analyzed the data, and we found that in 2019, the stability rate of the clinical condition among the rehabilitation patient was 76%, while in 2019, the relapse rate among the rehabilitation patient was 24%. 2% of the relapse patient required admission to the inpatient, while 22 received the treatment as an outpatient. While in 2020, the stability rate of the clinical condition among the rehabilitation patient was 63%. The relapse rate among the rehabilitation patient in 2020 was 37%, only 2% of the relapsed patient required admission to inpatient unit, while 35% received the treatment as an outpatient. So after we collect the information and we analyze the data, we write our conclusions. Among the patients being treated with rehab psychiatric during the April 2019 till 2020, patient who has confirmed established schizophrenia diagnosis associated with increased relapse required admission. In addition to relapse required, revise the care plan. We recommend further observation data is need to confirm this relationship. We found no correlation between the type of psych medication and the relapse rate, and we found no correlation between the number of the follow-up visits during the mentioned period and the relapse rate. We found also no correlation between the relapse rate and the addition of the depot injection to the oral medication as well. Intervention that promote encourage the social skills and family support may prove significant in improving overall outcome when treating the rehab patients. And finally, our recommendation was early relapse symptoms need clear documentation in patient's file. Adherence state need close monitoring by the family and the caregiver as well. Further study to know if there is a correlation between the type of the long-acting injection and the relapse rate was requested, and further study to explore if there is a correlation between the COVID-19 and the relapse rate among the rehabilitation patient was suggested. We recommend drawing forward a solution if there is any recurrence health crisis as well. That's it, and thank you very much all. We will open the door for any questions.
Global Prevalence and Trends in Anxiety Disorders. Hello, I'm Jawad Hashim, an associate professor in the Department of Family Medicine and a research epidemiologist at the College of Medicine and Health Sciences at United Arab Emirates University. Today, I'll be talking about anxiety disorders and the trends that we observed over the last 3 decades. These are our learning objectives. My data source is the Global Burden of Diseases study, and this is a data set compiled by Global Prevalence and Trends in Anxiety Disorders. Hello, I'm Jawad Hashim, an associate professor in the Department of Family Medicine and a research epidemiologist at the College of Medicine and Health Sciences at United Arab Emirates University. Today, I'll be talking about anxiety disorders and the trends that we observed over the last 3 decades. These are our learning objectives. My data source is the Global Burden of Diseases study, and this is a data set compiled by the Institute of Health Metrics and Evaluation at the University of Washington in Seattle. This is a very expansive database that includes more than 200 diseases and health conditions compiled from countries all over the world. And the latest database refresh was just a few weeks ago and includes data up to 2019. Anxiety disorders rank at the top in terms of prevalence among all mental health illnesses. So they are more common than depression, schizophrenia, autism spectrum disorder, bipolar disorder, etc. And this should come as no surprise, as anxiety disorders include a wide spectrum of illnesses, including generalized anxiety disorder, social phobias, obsessive compulsive disorder, and others. This world map shows the distribution of anxiety disorders based on prevalence. So the colors indicate prevalence rates based on population per 100,000, and this includes all ages. The age structure of different countries has been standardized to ensure easy comparison. So countries with more elderly people and those with a younger population both have been adjusted to make their population structures similar. This distribution is notable for increase anxiety disorders appear to be more common in Western Europe, United States, and South America. In general, coinciding with countries with greater socioeconomic development. A couple of countries stand out, including Portugal and Iran, having high prevalence of anxiety disorders. This is a list of countries ranked according to the prevalence of anxiety disorders, and at the top is Portugal, followed by Brazil. Surprisingly, there are countries that one does not associate it with anxiety disorders, such as New Zealand, Switzerland, France, Malta, Germany, Australia. All these countries are noted to have high prevalence of anxiety disorders. Interestingly, the ranks have not changed significantly over the last 30 years. So Portugal still ranked first in 1990, and many of the Western European countries rank high in both the 1990 and the 2019 tables. The age distribution of anxiety disorder shows a rapid rise in the late adolescence and then continues high throughout the adulthood, with some declines over the last decades of life. This is a chart that shows prevalence. This graph shows incidence of new cases. So new cases occur throughout life, including in childhood as well as adolescence. However, the incidence of new cases declines after the age of 60. As is well known, anxiety disorders are more common among women as compared to men, and this appears to be a fairly stable finding. Analysis of the trends over the last 30 years from 1990 to 2019 shows fairly stable prevalence rates. For example, the global prevalence, which is shown at the dark green line, which is the lowermost line, has been fairly stable. United Arab Emirates, shown in the purple line, has also been stable over the last 3 decades. Interestingly, the prevalence of anxiety disorders is rising rapidly over the last 3 years in the United States. It is important to compare prevalence rates using age-standardized measures because population structure may change over time due to migration and changes in birth and death rates. For this reason, age-standardized rates are used to compare trends. Using age-standardized rates, the global prevalence of anxiety disorders has been fairly constant over the last 30 years. Focusing on in the Middle East region, we can see that Middle East generally has a lower prevalence of anxiety disorder compared to Western Europe. Countries such as Syria and Iraq and Libya have higher rates of anxiety disorder, possibly due to political turmoil in these countries. It is interesting to note that the migration of refugees from Syria to Western Europe goes against the prevalence of anxiety disorders, something that the refugees may not realize. Within the Middle East region, a ranking of countries according to the prevalence of anxiety disorders shows Iran, followed by Lebanon, Syria, Libya, Palestine, and Iraq. So some of the countries that have experienced significant political changes. It is interesting to see the trends over the last 30 years for these countries in the Middle East. All the countries seem to be following a same band of prevalence of anxiety disorders. The only interesting exception being Lebanon, which is in the blue line at the top of the group. Positively, there has been some decrease in the prevalence of anxiety disorders in Lebanon over the last few years. It is important to put anxiety disorders in the perspective of all health illnesses. In this heat map, we can see anxiety disorders have fairly moderate to mild contribution towards non-communicable diseases or chronic illnesses. So within chronic illnesses, anxiety disorders play a significant role. However, they are less common than other illnesses such as headaches, dental disorders, back pain, etc. The 2019 rank for all health conditions shows that anxiety disorders rank at number 18 in terms of prevalence. So in summary, anxiety disorders are the most prevalent type of mental illness, far exceeding depression, bipolar disorder, schizophrenia, and other behavioral disorders. Certain regions have higher prevalence, such as Western Europe and North America, as well as South America. Some of these countries in these regions, such as Switzerland and Australia, are typically not associated with anxiety disorder. The prevalence has been stable over the last 3 decades, not showing any rising or decreasing trends. The incidence remains high during adulthood. Women are affected more frequently than men. Thank you for your attention.
Hi, my name is Clara Menezes, and today I will be presenting to you on the topic of stress reduction through mindfulness-based meditation among the psychiatric nurses in response to COVID-19. Let's have a look how this affects our nurses. Nurses are the frontline workers in healthcare setting. Stress, fear, anxiety is increasing among the psychiatric nurses while delivering needed care to the patients. Due to the social distancing norms, there is a psychological barrier between the nurse and patients to conduct a therapeutic engagement. Some of the key concerns worrying the nurses are the social distances amongst our colleagues and other co-workers. In this slide, you can notice the nurse is having internal conflicts of engagement, whereby she thinks her patient might get affected by COVID-19. She is worried about her vulnerability due to medical comorbidities and age factor. In this slide, we can see, due to the increase in COVID cases, how drastically the therapeutic engagement has reduced, which shows low therapeutic engagement alert. In order to combat the hurdles, we have initiated a program on mindfulness meditation by analyzing the stress levels of the nurses via pre-test done using SurveyMonkey. In the preliminary result shows the nurses were moderately relaxed, with only 6% of the nurses dealing with stress appropriately, while the problem-solving approach was still a work in progress. Here, there are 5 mindfulness exercises we can do anyway, which we have adopted: mindful listening and mindful breathing. According to Don Bazzacco 2013, it was proved this program is low-cost, feasible, and scalable interventions that shows positive impact on health and well-being of nurses by reducing their burnout and may improve their performance in their work areas. After 2 weeks successful implementation of mindfulness meditation exercises, which have increased the relaxation level significantly from 6% to 37%, while also improving the problem-solving capabilities of the nurses. Here we begin our day with mindful meditation in my unit. In conclusion, I would like to say nurses were able to render better care with full conscience to our psychiatric patients after participating in mindfulness-based meditation activities. The technique of mindfulness meditation, which emphasizes on sound mind in sound body, may represent a powerful cognitive behavioral coping strategy in reducing stress for transforming the ways in which we respond to life events. Mindfulness meditation is not only for the nurses, it can be practiced in community, schools, or any other working areas. Hope this helps. Thank you for your active listening.
Live.
A big thank you to all the poster presenters. So now we encourage all the delegates to visit the booth in the virtual exhibition and chat with the representatives while waiting for the live streaming to resume.